There was a time in the history of diabetes where developing secondary complications were sort of the norm. It was sort of the expectation that if you had diabetes long enough, you were going to have a lot of problems. But then some really important research was done, starting with the Diabetes Control and Complications trial, going through the United Kingdom prospective diabetes studies, the diabetes prevention trials that were done in this country, in Finland and China and other places, that really showed that with a little bit of thought and a little bit of effort, you can control your glucose much more effectively and reduce the risk of developing many of the complications of diabetes, or in fact reduce the risk of developing diabetes itself. And I think that prior to my generation, a lot of people thought that diabetes was not a death sentence, but it was certainly a sentence of a life of hardship and disability. And I don't think it has to be that anymore. We live in a golden age, nobody wants diabetes, but if you had to get diabetes, this is not a bad time to have it. There are tremendous avenues for treatment. There are sophisticated ways for figuring out what your glucose is doing and responding to it. There's a lot of medications and lifestyle options that just didn't exist even 10 years ago, let alone 20 or 30. So we really have a lot of opportunity. It requires that you put some effort in. There's no free lunch in anything, particularly in diabetes. So it requires you put some effort in, and it requires that you work with a good team. That team should include your healthcare provider. It should include dietitians. It should include nurse educators. It should include your family. It should include your friends. You can do a lot of things with a good team around you and optimize your situation. I've never met a person with diabetes who couldn't make their situation better with just a little bit of time, thought, and effort.